Everybody, my name is Vanji David, and today I'll be doing a quick assessment of our patient. So before I start, I just want to inform you, once I go in the patient's room, I'm already assessing the patient physically, how they're breathing, how they're talking to me, how they're responding, and I'm also looking at the patient's environment, if they brought in any wheelchair or cane, or are they using oxygen as well. And also, it would be good as we go along the patient's assessment, it would be good to ask the patient questions just to get the subjective side of the patient and also at the same time getting the objective side and documenting it towards the end. Okay, so let's start. And Josh, hi, good afternoon. My name is Vanji David, and I'll be your nurse for today. I'll just be doing a quick assessment before your doctor comes in, okay? Can you please check your arm back first? Can you get your name?
Joe.
And your date of birth?
3/27/73.
Okay, thank you. And would you know who the president of the United States is currently?
Biden.
Thank you. And would you know what time it is right now?
About 9.
So what brings you in here, Joe?
Kind of like sluggish and sneezing.
Sneezing, okay. So when did it start?
A couple of days ago.
So already off the bat, I'm already showing that the patient is alert oriented times 4. He was able to answer all my questions. It's good to take note on the Glasgow coma score at this moment and document it. Highest would be 15. The patient was spontaneous. Eye opening was spontaneous. Patient was oriented and was able to obey commands. So that would score 15. If it was an 8, there could be some injury right there. So also another check for neuro. A neuro check would be for sensory. You can have a cotton swab at the end. You can break it off and have the patient tell you if they're feeling something dull or sharp. You can try it on extremities and lower extremities as well. So also, of course, we're checking on the patient's vitals for baseline. Can I please check your vitals, Mr. Joe?
Yes.
Okay, thanks. So I checked his blood pressure, heart rate, respiration. O2 saturation, very important. And of course, are you feeling any pain right now?
No.
None as of the moment. So 0 on a scale of 1 to 10 for pain. So now let's start with our physical assessment. So, we're just going to put on our gloves. Of course, we're going to go from head to foot, okay? Just to get a system going so we don't forget anything. So for now, I'm just going to check on the patient's head. Is it appropriate for the patient's body, the size of it? So do I see any drooping of the face? It's a good time to check for cranial nerve number 7, which is the facial nerve. Okay, there's a test for that you could do. So also, if there's any drooping, as I said, which is a sign of stroke. So now we're going to palpate on any mass or indentation on the head. You can check for hair as well for this one. If there's any beard, look into that as well. If there's any lice or at this time we're checking for mass too. And if the patient is immobile, make sure you check the back of the head for that one, okay, if there's any indentation. So now we can check for sinus as well. So what we're going to do, ask the patient if you feel any pain. How about here?
No.
So we just check for sinuses at the maxilla and frontal, okay, part of the face. So now we can go and look at the eyes. So right off the bat, you're looking at the eyelids if there's any swelling going on. So there's none. The pupil of the eye, of course, the sclera should be white, not jaundice, not yellow. And also we're looking at the conjunctiva if there's any drainage or anything. So there's none. All right, so how do we check for perla? We're going to use a pen light. You can dim the lights, have the patient look far. Please, thank you, Joe. And you're just going to look at the light, okay, once I shine it on your eyes. So right there, what are we looking for? We're looking for constriction once the light shines on the patient's pupils. So once he looks out, pupils dilate, and with the light, it constricts. So I would document that as pupils equal, round, reactive to light, and that is perla. So now we're going to look at the ears. So again, inspect the ears bilaterally. There's no drainage. Okay, there's no drainage. And we're going to palpate The mastoid process. Is there any pain you're feeling right now? Okay, no pain for the mastoid process right at the behind the ear. So also for this one, you can use an otoscope to look inside the ear to check the tympanic membrane, make sure it's shiny. It's okay to have a little bit of earwax, of course. And how do we use the otoscope? We pull back and pull up. Okay, so that's for adults. For children, we pull back and we pull down. So also, this is a good time to check for the vestibulocochlear cranial nerve number 8, which is the whisper test. So occlude one side of the ear, whisper one word or two, and have the patient repeat. And also at the other side, so that's the whisper test. So now we're looking at the nose. Okay, looking at the nose, we're inspecting again. If there's any drainage, look at the nose. If it's midline, if there's any deviation going on, evidence so there's none, and there's no occlusion. So I have the patient occlude one nose, please, and then breathe, and the other as well. Are you able to breathe okay with that?
Yes.
Okay, so there's no occlusion, there's no drainage going on as of the moment, but he did complain of sneezing. So we'll look into that further. So this is a good time also to check for cranial nerve number 1, which is olfactory. Okay, so have the patient smell on a certain thing and have them guess what it is. Okay, so have them close their eyes and have them smell on an object. So now we can expect the mouth. You can use a tongue blade for that and your pen light. So please say for me. Thank you. And then up. And it's okay to look below the tongue as well if there's any drainage over there. And we're looking for lesions, for dental caries, for cavities. Any dehydration, you look at the tongue as well for the patient. That's where you could tell if the patient is dehydrated. Okay. And is it moist? Are there any lesions? Also for this one, you can check for cranial nerve number 9, which is glossopharyngeal. Okay, for this one. And also for here, we can now check for the trach. Is it midline? All right. So now we inspect first, and then we auscultate for bruit of the carotid. Okay, we're gonna auscultate. All right. Auscultate for the bruit. If there is, you document that, and that is a normal sign. So now we can go to cardio. So I did mention about the carotid. So first we inspected, and then we auscultate. Now we're going to palpate one at a time, not bilaterally, as to not occlude anything. So now we're going to palpate for carotid. And also for this one, have the patient lay down. You can palpate for radial pulses, femoral, right here, bilaterally, popliteal at the back of the knee, and have them lay down, and you can check on posterior tibial side of the foot, and pedal pulses right in front of the foot, okay, bilaterally, and compare. If there's any deviation to that, jot it as abnormal. Patient could have AFib or differences in strength there. Okay, so that would give you a lot of information about the patient's cardiovascular system. So now we're going to auscultate for heart sounds. Is it okay if I check on your heart sounds, Mr. Joe? Okay, perfect. So for this one, we're going from which is the aortic. We go down the second intercostal space on the right. That is the aortic. And now we go to the left, which is pulmonic. So for those two, we're looking for S1 and S2 along the way. For this one, prominent sound will be S2. Okay, now we go to Erb's point. We go down a little bit. And then the tricuspid will be the fourth intercostal space. And now the final one is the mitral valve around the nipple line. Fifth intercostal space, which is also called the point of maximal impulse, which is the apical pulse, which we check for 1 minute. Good sign of checking for patient's pulses. Okay, so now we'll go to respiration. Also, by the way, you can use the bell of your stethoscope to check for heart murmurs, which is the lower pitch sounds, okay, of the heart. All right, so heart murmurs, and then you check for the high-pitched sounds. If there's any difference, you note on that and document on that. So now we'll go to respirations, and then we'll check for anterior and posterior lung sounds as well. Is it okay if I check on that? Do you have any pain breathing, shortness of breath? So we're asking subjective questions. We're trying to get subjective answers right now. So now we inspect for symmetry. How do we do that? How is the patient breathing? Is it equal? And what we can do is have the patient turn back and put your hand in the butterfly position. Pretend that he's turned back, and then put it against his ribs. If it goes up and down bilaterally and it's symmetrical, you note that too. So is he using any accessory muscles during breathing? His diaphragm. So after inspecting and auscultating, also when auscultating, we do it in a zigzag manner. Okay, why are we doing that? Just so that we're able to compare bilaterally all the points. Okay, clavicle going down in a zigzag manner. Okay, so now we're done with auscultating. We're now going to also we're inspecting for barrel chest for COPD. Have them turn on the side. Look for any differences in his chest area, and we already asked for the patient for subjective questions. So now we're going to the patient's abdominal area. So is there any pain in your abdomen? When was your last bowel movement, Joe? Okay, so now we're also going to inspect first. Again, inspect the abdominal area. Is there any hernia? A good time to check if there's any ostomy or any G tube on the patient that he's using. Is there any drainage? And also now we're going to auscultate. When we auscultate for the abdomen, we're also going on a certain pattern. We start from the right lower quadrant, going up, right upper quadrant, left upper quadrant, and left lower quadrant. So we're looking for vowel sounds. Is it hyper, hypo? Okay, for vowel sounds, and you note that. So now we're checking, now we're palpating the patient's abdomen. Have them lay down, of course, and we're going to palpate for 2 centimeters depth first, okay? Do you feel any pain right now? So no masses, no masses. And if there's none, you can go deeper. Okay? So now we can check on the muscles. So any joint pain, nothing? We can, okay. So we check for the grip on me, the strength, okay? Grip, both hands bilaterally. So I would score that as a 5 plus. And also check for the drift. Like this, have the patient stand up. And another indication of stroke, if there's a drift like that, the patient could have had a stroke or any sign of stroke. All right, so now for skin, hair, and nails, we're going down towards the leg at this time. The patient would be laying down flat, and we're checking for the legs. We can press on the patient's tibia if there's any indentation, if is there any edema. All right, so if it's pitting, you note on that too, 3 plus or 2 plus or plus 1 or 1 plus 1. And so that's for edema. So you push on the tibia for that. So now we're inspecting again the color. Okay, is there any discoloration going on? Amount of hair, the toenails of the patient. Is it ragged? Is it dry? Is there any fungi going on? Does the patient have any wounds? Very important. If the patient is diabetic, you would probably see wounds or pressure ulcers. Check for that as well. And also you check for Holman sign. Have the patient bend their foot. Okay, pretend they're laying down, and have them dorsiflex. If there's any pain, that's a positive sign, positive Holman sign. Okay, you can indicate that on your documentation. Check if the patient's leg is shiny with no hair. Could be a sign of PVD as well. Okay, so after that, document everything. Remove your gloves, hand wash. Document everything that you've found, important things, abnormal findings, and make sure the patient is comfortable while doing the whole process, and document and inform your MD for any abnormalities right away. Okay, thank you so much.